Hello, I am Dr. Ibraheem Shareef. I'm a pediatrician with Golden Valley Health Centers. I've been working at Golden Valley Health Centers for over 9 years now. In the pediatric clinic, we see a lot of respiratory conditions throughout the year. It's important to know that the influenza infection is one of the most common respiratory infections and one of the deadliest. The flu typically would cause cough, sore throat, fever, fatigue, and body aches. But this does not always stop here. Sometimes the flu infection can result in complications, and this includes bronchitis, which is inflammation of the airways. It can cause pneumonia, which is inflammation of the lungs. And having an infection with the flu also makes it easier for bacteria to cause infection in the lungs. Any child can develop complications from the flu, but there are children who are more at risk, and this includes younger children who are under the age of 5 years, and also children who have chronic medical conditions such as asthma, diabetes, certain heart conditions, and problems with immunity. The influenza immunization is the best way to protect against the flu. Getting the influenza immunization is easy, it's safe, and effective. We recommend to do it as soon as possible during the flu season, which is usually in September or October, but getting it anytime during the flu season is also important. When the child receives the flu immunization, there is less risk of getting the flu, and even if they do end up catching the flu, chances that the symptoms will be milder and there's less risk of complications. So what this means to your child is milder symptoms, less missed school days, less trips to the emergency department, and more importantly, less risk of the need for hospitalization and less risk of death from the flu. Another reason to get the influenza immunization is to protect people around you and your loved ones, especially those who are at higher risk of getting complications from the flu infection. And these include older family members, pregnant women, people who have chronic medical conditions, and people with weak immunity. Regarding safety, the flu immunization is a very safe vaccine. The chances of having a serious reaction when you get the influenza immunization is very, very rare. The influenza immunization will not get you to get infected with the flu. There are some side effects which are mild and do not always happen, and these include pain around the site of injection, sometimes a little bit of a slightly elevated temperature, and some body aches. But even if these side effects happen, they are much milder than getting the actual flu infection. Personally, for my children, I want to try to give them the best protection available against the influenza infection. And I'm sure that you'll want to do the same for your child. The influenza immunization is the best way to protect your child and your loved ones.